Hey guys, Angie Woods, Dog Psychology 101. So there has been a strange, mysterious upper respiratory infection going on with dogs in our country. We don't know what it is. It's not testing positive for anything that we know of as of yet, and it's been very resistant to common antibiotics. So the symptoms are just like any other upper respiratory infection in a dog. Coughing, lethargy, be pretty lethargic, not wanting to eat, maybe even getting dehydrated because they're not wanting to eat and drink. So these are all very common symptoms of what we, as a general term, call kennel cough. Kennel cough is many bacteria and or viruses, kind of like our common cold, if you will. So if your dog starts to show any type of upper respiratory symptoms, I recommend getting to your vet right away and just be sure that all is well, because it is resistant to most antibiotics, and the longer you wait, the harder it's going to be to treat. So, some things to help you protect your dog. Number one, if your dog has been exposed to other dogs that go to daycare and things like that, then we're kind of opening them up to higher risk of infection, if you will. If you have a friend or family member who has just adopted a dog from a shelter, I would hesitate to introduce them initially. I would say a quarantine period of minimum 14 days. If you want to be really careful, say 21 days. I have a rule here, 21 days, no visits from dogs that have been in a shelter or exposed to a dog from a shelter. Any kind of boarding or daycare, things like that, you want to inquire with the operator at the facility what their precautions are, and be sure that they are not allowing dogs in from those type of situations, and that they are inquiring with people checking their dogs in about any kind of symptoms or potential exposure. So we all learn from our own pandemic about how viruses work, and it's really scary when you have kind of a high death rate here. So be careful.